Local Health Watch are independent organisations, and we work to put the voice of local people, their experiences and their opinions at the heart of health and social care planning and delivery. So we do a lot of going out and talking to people using surveys or focus groups. In West Yorkshire and Harrogate we have 6 Local Health Watch, and we work quite closely together. Health Watch play a part in the West Yorkshire and Harrogate Healthcare Partnership because we've talked to over 5,000 people around important health and social care issues. Things like paramedic training and urgent care, why people are ending up in our A&E departments, NHS dentistry, and the most recent piece of work we did was around stroke services. Fundamentally, you can't reshape services without asking people who are using those services what's best. I mean, one of the things that we've absolutely learned at Health Watch is if you don't ask local people, then decisions are made that don't necessarily meet the needs of those local people. There are a lot of big changes happening with health and social care, so we think what's really important for Local Health Watch is that we all work together, because across West Yorkshire and Harrogate, health and social care services are aligning themselves much more closely, making sure that the local people who use those services are engaged with properly and effectively, and maybe some of their concerns are alleviated about the future of health and care services.
We help feed people's thoughts and views into the design of new services. So we've been working to look at A&E departments and urgent and emergency care proposals. Secondly, we act as a critical friend to the partnership, and we challenge them when we think that some of their plans don't represent what people really want. And thirdly, the STP gives us an opportunity to bring new issues to the partnership that we've struggled to address over the last 3 years.
Hello, my name is Professor Sean Duffy. I am the clinical lead for the cancer programme for the West Yorkshire and Harrogate Sustainability and Transformation Plan. The West Yorkshire STP allows us to plan for the long-term good of patients across a whole population. That means essentially we can tackle some very big health issues. In West Yorkshire, 250 people a week are diagnosed with cancer, and it can be that up to 115 people each week die from this disease. What cancer patients tell us is they don't want or do not recognise false boundaries between organisations. Our job is to plan to make sure that patients' pathway of care is seamless, and that for them it's a smooth movement from diagnosis through to treatment. If we successfully work together, we can realise the key ambitions for our patients. The first ambition is, if we can, prevent cancer before it even starts. 4 out of 10 cancers are preventable through lifestyle changes. For example, we'd like to see 100,000 less smokers across West Yorkshire and Harrogate by 2020. Our second key ambition is to make more cancers curable. If we can move what is currently 4 in 10 patients diagnosed at a stage when they can get curative treatment to 6 in 10, we will save at least 3,000 patients dying from their cancer unnecessarily. The third ambition is to put patient experience centre stage to how we plan and deliver our services. We want the impact and reach for patient feedback to be felt as part of the delivery of our care.
I hope you found this information useful. It is, though, only the start of a conversation that I want you to continue to be a part of.